Dr. Rafich here from Vet Triage. We are going through this April 2022 edition of Veterinary Surgery. We're going to talk horses today. Ex vivo, where is it? There it is. Ex vivo biomechanical evaluation of a polyester and polyblend suture techniques to perform equine laryngoplasty. So first off, they are just comparing different suture types based on different materials. This, and then equine laryngoplasty is a generic name for laryngeal surgery that involves creating a permanent opening, or rather a wider opening of the larynx. So in the picture below, right here, this is a normal larynx of a horse, and then this is one that's showing hemiplegia or laryngeal paralysis. You can see this side is sunken in because it's not moving. So even though these are still images, normally these two pieces of cartilage, the arytenoids, should be moving back and forth as they breathe. And then in this case, this one is going to be moving back and forth, but this one's going to kind of just sort of flutter there, moving just because of airway resistance, but it's paralyzed. So I also have this condition is not too different than that of dogs, and so I do have a video on this disease in dogs on my channel. Feel free to look at that. This study comes out of a hospital in Italy, a hospital in the United Kingdom, and a hospital in Ireland. So the objective is to validate the use of a polyblend tape suture in equine laryngoplasty. It's an experimental cadaver study, 32 specimens. Each larynx was assigned to one of 4 groups. Now, this paper is very engineering focused, which doesn't translate well to videos like this. So it's fairly dry, and a lot of it it's beyond my wheelhouse. So I'm probably going to skip a lot of the findings, or if I do go through it, I'll go through it briefly. But what we really want to know here is the conclusion. What did they find in this? So bear with me. So the laryngoplasty with polyblend tape suture, known as tiger tape, was one group. Then they did a laryngoplasty without tiger tape. Then they used one with a cannula and tiger tape, and they placed that in the muscular process of the arytenoid cartilage. So this is the one part of the arytenoid cartilage. On the very back of this, behind this structure, part of the arytenoid cartilage is a muscular process. It's a common location to place the prosthetic to create that permanent opening of the glottis. And then they also had the other groups are the laryngoplasty with polyester suture, like Ethibond, without Ethibond, and with a cannula with Ethibond. After cyclic testing, the total migration and creep were lower in the cannula tiger tape group. So the numbers they give here are 6.36 millimeters and 1.35 millimeters per second. Then compared, so those numbers were lower than the Ethibond group, which is 11.12 millimeters at 3.39 millimeters per second, and as compared to the tiger tape group at 11.26 millimeters and 3.2 millimeters per second. So that's how much displacement and how fast displacement occurred under testing. They had found no difference between the Ethibond cannula group at 9.19 millimeters and 2.14 millimeters per second. A correlation was found between total migration and creep, meaning that the more migration there was, the more creep there was, and then vice versa. The cannula with tiger tape constructs failed at higher loads, 129.51 newtons, versus the Ethibond group at 93.16 newtons, and the Ethibond cannula group at 81.72 newtons, whereas the Ethibond and Ethibond cannula constructs were less stiff than the tiger tape and tiger tape with cannula. So the conclusion was biomechanical properties were generally superior for the tiger tape cannula constructs under cyclic loading. The cannula in both the Ethibond and tiger tape reduced the failure at the muscular process. So the clinical significance is that these results provide evidence to support that the in vivo evaluation of the polyblend tape suture with or without a cannula in the muscular process of laryngoplasty in horses. So introduction, the Reported success rate of prosthetic laryngoplasty in racing horses ranges from 38% to 70%. Loss of arytenoid abduction, which is what this is here, after surgery is the most common complication following laryngoplasty, usually in the first week postoperatively. Multiple factors seem to be involved with this loss of abduction, including suture slippage or cut through cartilages. The polyester sutures, so the ethibond, in human surgery, their use has been supplanted by polyblend sutures, which have higher tensile strength. A novel polyblend tape suture designed for human rotator cuff repair, called the Tiger tape, has demonstrated increased resistance to tissue cut through during mechanical testing. So that is confirmed by this paper, where the Tiger tape is stronger than the ethibond. Regarding materials and methods, the specimens were excluded if they had any gross evidence of cricoarytenoideus dorsalis muscle atrophy. That's the muscle that gets atrophied with this neurologic condition that affects the opening of the larynx, or if they had any other laryngeal abnormalities. For these specimens, the extrinsic musculature and the cricoarytenoideus lateralis were removed. For the surgical technique regarding the cadavers, they did a left-sided laryngoplasty, and usually we do left-sided because most surgeons are right-sided. But obviously you're going to do the side that the horse is paralyzed on, and left happens to be also the more common, but they can be paralyzed on both sides. This is the machine that they use to do the testing on the larynx cadavers. The horses were a median age of 9.5 years, mostly females, mostly thoroughbreds. The mean distance of the suture placed from the caudal edge of the cricoid cartilage was 10.4 millimeters and 6 millimeters from the cricoid dorsal ridge. And there was a correlation found between total migration and creep. Now the rest of these numbers, I'm going to go through them, but it's going to be quite dry. Actually, you know what? I'm not going to go through them. We're going to skip the results. They measured a ton of stuff here, guys. I mean, this is it's a lot of measurements. We'll just skip it because it won't mean much to those who are watching this. I will go to this part, failure of laryngoplasty. So with the ethibond group, the constructs failed due to cutting through the muscular process. And in one case, the suture broke far from the knot. Eventually, all the Tiger tape specimens failed due to muscular process cut through. The ethibond with a cannula failed due to breakage of the suture on the cricoid button, except for one case in which the suture broke randomly but far from the knot. Finally, the Tiger tape cannula specimens failed due to random suture failure or failure of the muscular process. Okay, discussion. Tiger tape specimens showed higher resistance to failure, whereas at cyclic loading, the Tiger tape exhibited higher stiffness than ethibond. The insertion of the cannula into the muscular process improves stability of the constructs, reducing creep rate and total migration. These are pictures showing the failures. Those blue arrows show where the constructs failed. Marked or complete loss of prosthetic laryngoplasty abduction occurs in 3% to 11% of laryngoplasty cases, usually within the first week of surgery. Stiffness of the prosthetic laryngoplasty was affected mostly by the suture material used and its intrinsic stiffness, with our data showing that the Tiger tape is stiffer than ethibond. The approximately circular cross-sectional area of the ethibond decreases when subject to a tensile force due to the positive value of the poison ratio, poison being POISSON, it's about 0.3, resulting in a low tensile stiffness, whereas Tiger tape cross-sectional area was less affected by this phenomenon due to its tape nature. Indeed, the Tiger tape contact area seems to distribute the pressure more evenly, especially in cases where pull-through is a concern. So we're seeing that the flatness of the Tiger tape helps with the distribution of pressure when it's being stressed versus the circular cross-sectional area of the ethibond. Prosthetic laryngoplasty failure has been attributed previously to failure of the cricoid cartilage, failure of the muscular process, and less commonly to prosthesis breakage. Furthermore, it has been demonstrated that the stability of the prosthetic implant is correlated with the stability of the cricoid cartilage and the muscular process of the arytenoid. Tiger tape with the use of a cannula demonstrated higher strength when loaded to failure. However, the load at failure of these specimens was lower, about 100 newtons for Ethibond and 150 newtons for tiger tape, than in other studies where similar load conditions were applied. A study reported a failure of the arytenoid cartilage at 240 and 142 newtons for Ethibond and fiber wire sutures respectively. Similarly, in another study, arytenoids anchored with a self-tapping cannula connected to fiber wire failed at around 180 newtons, and then another study by that same group revealed higher values for Ethibond at 280 newtons and fiber tape at 220 to 340 newtons, depending on the construct. The swallowing frequency of horses recorded in vivo is 0.013 hertz, which is what causes a lot of the pressure, they think, to the surgery, risking its failure in real horses. And that's it. That's the study. So a quick one, because I skipped over all the dry stuff. But anyway, for those who are interested, that's pretty cool. And I look forward to things like this happening in real cases. Thanks for supporting the channel. We'll see you in the next one. Bye.